Okay, we are ready to begin. I'd like to start by introducing our keynote speaker, Dr. Yee Gary, MBBS, MPH, and MBA. Dr. Yee is AI medical innovator, public health consultant at National Healthcare Group in Singapore, holds an MBBS, MPH, and an MBA plus diplomas in various fields, has won many awards, including Clinician Leadership in Research, NHGCMTI Innovatory Program, and has held roles as health services researcher, clinician, advisor in HEAL, academic editor for Plus One. Recent projects include chatbot for ischemia, education, improving lung function tests, AI-driven treatment adherence, and workplace health initiatives. I'd just like to ask everyone to please remain muted until the end. If you have a question, I will announce that at the end. So Dr. Gary Yee, please. Oh, let me introduce the title, Use of Large Language Models in Patient Education. Dr. Yee.
Hi, can you see my screen?
Yes, we can.
Okay, thank you for having me today. So, a bit about myself, I need to be introduced. So, I'm a researcher in AI, diabetes, workplace health. I'm a clinician advisor for AI, workplace health advisor, as well as primary care physician. If anybody interested, you can actually add me on LinkedIn. I'm quite active on LinkedIn, so I'll post this after the presentation. Okay, this is the typical picture. Okay, a busy emergency department. Okay, this is the same anywhere in the world. The question is, can we improve the patient experience using conversational AI? Do we still have to wait at the ED department, emergency department, or is there a way that we can actually pre-triage our patients' symptoms so that we can then allocate them based on severity? This is something I hope to address. Okay, let's start. What is conversational AI? Yeah, this is blocking here. So never mind. So it's actually a software that can enable user to communicate with devices in natural language. The problem is computers do not speak human language. And obviously, unless you're a programmer, the humans don't really speak the computer language. So the problem with this is that yeah. So what we do is we want to simulate human conversation. So it's something like Siri. Ask Siri.
Sorry, may I ask everyone to please mute if
Okay,
you're
sorry for
not
that.
speaking. Sorry about that, Dr. Gary.
No problem. Okay, so we can actually simulate human conversation via natural language processing, which I'll explain in the next slide. So to help machine understand human language, we can also use speech recognition. If anyone is using Zoom now, you can see there's actually a transcription function, which is not 100% okay, but it can actually transcribe probably on 90%. And machine learning. So the users are in three areas: chatbot, voice assistant, and an interactive voice response. So my interest is mainly on chatbot, and this is something that before ChatGPT, large language model, chatbot was very dumb. You have to use keyword, and most of the time they do not satisfy the need, so you need to escalate to a human. Right now, with large language model, we realize that we can actually help simulate. You can't even tell whether the person is a human or a chatbot. So natural language processing is the use of advanced algorithms and models to process and analyze textual data from clinical documents, patient records, and medical literature. So we have done this in clinical documentation. So what I did was we actually put our information into the chatbot that is secured, and then it can actually help summarize. So we have created chatbot to do that. In Singapore, we call that Tandem. So Tandem is like a large language model that is actually secured. So we actually tried experiment using it for ambient AI as well as transcription AI. Clinician decision support. So it can also give you real-time recommendation based on the records. So based on the records, it can recommend whether patients need to go for their food screening, eye screening if they have diabetes, or their yearly checks. For patients who have gone for colonoscopy, for example, in the last 5 years, it can also send an alert So instead of you having a registry, it can actually send alert that you should go for your colonoscopy after 5 years. Risk stratification. So this is a project that we've done. So we identify high-risk patients for readmission so that the community partners can go in to actually intervene. Automated virtual health assistant. We actually done some chatbot, but it's not really tested out because patient fronting chatbot are actually quite high risk. So I'll mention more later. Patient sentiment analysis. We actually done this not for patient review, but mainly for those qualitative analysis for those researchers out there. There's a lot of transcription need to do. So what I did was we put the transcripts into the chatbot, and it can actually analyze some of the thematic analysis. You can also say whether the comments are positive, negative, or neutral. So one of the challenges is sarcasm. So the chatbot doesn't really understand sarcasm. So that's something that humans need to intervene. Otherwise, you may inadvertently think that the comment is positive when it's actually negative. Lead analysis. So I published a paper using BERT. So what we did was we actually used the chatbot large language model to kind of like be able to stratify whether the research study should be included in the systematic review or not. So these are some ways that we have done using natural language processing and large language model. To move on, so for patient education chatbot, so quite straightforward. This is done in patient education. Why we focus on this is number one, most materials for patient education is available publicly, so it's nothing confidential. You can train on it. Secondly, is that this is something that nurses, doctors would like to do if they have time. But unfortunately, without the time, you can just give a cursory education. But most of the time, the patient do not understand much of what you actually say. And most of the time, end up repeating yourself. So this is something that we want to build in so that a chatbot is available 24/7. Second thing is medical appointment scheduling. Right now, I'm not sure in what countries you're in, but most of the countries still relies on telephone or even fax. So you require somebody to call to make an appointment. Why don't you use a chatbot to automate this process so that appointment scheduling can be much more simpler, automated? So it can also help you to schedule all your medical appointment that don't call inside on the same day. And for example, if you go to cancel your, let's say you reschedule your lung function test appointment, you also need to reschedule your doctor appointment. Otherwise, you may end up seeing the doctor without the lab test being done. Then it defeats the purpose. Then you just wasted a visit. Clinic consultation, this is actually the holy grail. We try to do that. Right now, we have done ambient AI. So what this does is it helps to listen in. For some of you are interested, can Google Dragon Nuance. So I don't have time to show the video, but it's actually quite impressive. It's able to summarize the conversation between a doctor and a patient using the SOAP, a subjective, objective assessment and plan. So it makes easy for documentation so that patients and doctors can have more time interacting. So the doctors can see the patient in the eyes rather than be furiously typing all the way. And in the end, the funny joke was that after typing, after seeing the patient, the doctor asked the nurse, is the patient male or female? Yeah, so they have not even noticed whether the patient is male or female because to focus on typing, they actually focus really on the problem without actually noticing whether the person is what gender is it. So this is the National Diabetes Reference Material from Singapore. You can see that there's English, Malay, Chinese, as well as Tamil. So in Singapore, we are multi-cultural society. We have different races, ethnicity. So these are some of the things we have. So we actually done this very painfully. Can you imagine this is just for diabetes? All the other materials, we need to also do it using the different languages. With the chatbot function, we can actually create a chatbot that can actually explain the different languages. This is something that we've done. For those who are familiar with Singapore, we also created this thing called offhand lost my mind. I think it's called Sea Lion. So it helps to do a large language model on the Southeast Asian countries like Vietnam, Cambodia, where there's less research on it because it's not English. So that's why this is some of the opportunities. So I think later we'll just discuss about Nigeria, because I think Nigeria have many languages. So we can also discuss whether you use a chatbot to help summarize in different languages. So information is there, but it's difficult to access. This is just diabetes. You mentioned a patient with multiple chronic diseases. You need to click in, and this is just a PDF. It doesn't have any explanation function. Yeah, and most of the time, we actually peg it to a secondary school education. So most of the time, some patients may not even understand what the material is talking about. So my project is a lung function test. So recently, I've done some lung function tests. Firstly, you need to not to take a medication before going for the test. Always affect the test. Secondly, you need to know how to inspire and hold it there. So for elderly, it may be quite difficult. And then this actually takes a long time to do. For example, I was doing the VQ perfusion test. If you missed it, you have to re-wait another 5-10 minutes before you can redo it because they need to wait for the gas to escape. So with a chatbot, you can actually explain in real time or before the consult what the function test is going to be about, and so the patient can better prepare and not waste the time to redo the test or even rescheduling. All these things is inefficiency and helps to increase productivity. So the pain point, firstly, investigations are complex. For the doctor or the nurse to explain, it's actually quite a chore. So I think we don't really need to explain a test because a test is quite static. What you need to explain is more something that's more personalized to the patient. So you can use the chatbot to explain the uniform standard things, then the nurse time or the doctor's time can be better to explain things that's more specific to the patient, which the chatbot may not be able to address. So in a busy clinic, patients may not even have the time to ask questions, or they feel embarrassed because they see a long queue out there. They may not understand why they're going for the test. And sometimes patients don't go for their tests. So in Singapore context, we have about 20% default rate. So 20% of patients do not go for their appointment for the specialist clinic. So this actually results in a lot of missed appointment as well as inefficiency in productivity. So the solution is we need a chatbot that is trained specifically on the materials that we have prepared. So there are a lot of materials out there, and these are all publicly available. Nothing sensitive, nothing special, nothing confidential. It's something for the improvement of the patient's awareness of the disease in a layman context. We can also explain the results. In future, if we can actually help to explain the results, we can even manage to reduce hospital visit. Because right now, a lot of time, a patient comes to see the doctor just to get the results explained. But in our current model, is a fee-for-service model. This may not be really very feasible, but in future, we move to capitation. When you get the same amount of money, whether you see the patient or not, then the doctors, the healthcare professional may have to change our business model. So for simple cases, you don't really need to see a doctor. This helps to reduce the direct medical costs as well as indirect medical costs because you need time to travel from your home to the clinic. So history taking, so we can use voice recognition. I kind of mentioned that. The AI can actually use speech-to-text, ambient AI to transcribe the patient narrative directly to electronic health records in a manner that is in SOAP. So as you know, when you talk to a patient can move from story A to B. It can move from here forward and backwards. And after a consult, you may realize and miss a question. So the chatbot can be able to actually organize the information. Sentiment analysis, we can talk about this more. So you can even pick up things when the patient is not sure. So this can actually help flag up certain things that, for example, is the patient depressed? Does the patient have high risk of dementia or diabetes? All these things from voice. So the voice can actually, these are all in the early phase, but a lot of time voice can actually identify a lot of things. So there are some studies shows that you can actually predict diabetes risk as well as dementia risk just on the voice. So you may know that you also have this change in voice for Parkinson's disease. So all these things we can use the AI to actually analyze and suggest who may be higher risk so they can be called back for a further evaluation. Finally, natural language processing, so you can process and categorize information to extract relevant information, and you can actually auto-populate the subjective function. Objective part, still not very clear. So this is something that we need to focus on. That's the physical examination. But who knows, maybe in future, we can even use the face AI, which is something I'm working on to measure vital signs. So we can actually help to actually do a lot of simple history taking, simple vital sign taking just by using a video. So I spoke about a lot. So coming back, so conversational AI utilizes natural language processing, speech recognition, and machine learning to simulate human-like conversation. Because as I mentioned, computers don't talk human unless you're a programmer, you don't talk computer. So healthcare applications, one is patient education, explaining the results, diseases, and the treatment options. A lot of time we just tell patients this is a treatment option. We don't even spend time to say what are the alternatives. Appointment scheduling, this is a huge hassle. Call the clinic can answer, give a leave behind your phone number. They call you back, you're busy, you can answer. Clinic consultations, AI for speech-to-text transcription, sentiment analysis for better patient communication. And finally, I share a bit of my key project that I'm working on, the lung function test chatbot. We have funded a small sum of money to actually experiment. First, we'll test out on doctors, respiratory physician to see whether it can explain to a level that is satisfactory to the doctors before released to the general public. So benefits, number one, improve patient experiences, enhance access to information. I think this is important. Only if the patient understands the need for the test, the patient then can actually go for the test. Otherwise, they'll ask, why am I going for this test? Why am I going for this appointment? And finally, hopefully we can reduce workload in the long term if we manage to actually cut down the test explanation as well as the test results. Yeah. So thank you for sharing. Thank you for giving me the time to share. I hope I didn't go out of time.
No, that was fabulous. Thank you, Dr. Gary Yee. It's right on time. And we'd like to now begin our in-depth dialogue between Dr. Yee Gary and three Doctor Innovators. So we will begin with Dr. Leonardo Aguiar. I'll let you read Dr. Aguiar's impressive credentials as he asks his question. Please, Dr. Leonardo.
Thank you, David. Thank you, Dr. Gary. I really appreciate your presentation. And just to let you know, this past week, we had a presentation with some friends about VOA Health, natural language process that we can capture all the consultation for the patients. And one thing came up in my mind that in what ways can we use AI-powered speech-to-text transcription and sentiment analysis to improve patient-provider communication by identifying some emotional cues related to anxiety, depression, or stress?
Hi, thank you for the excellent question. So, coincidentally, we just released a news article to say that we are doing research to see whether we can detect depression using voice analysis. So this is something that is very close to my heart because I think Singapore is facing an aging society. So we can actually take the opportunity to actually screen for depression among the elderly. You can realize that from the tone and whether the patient is willing to give a history. As you all know, in medical school, we are also taught that sometimes you cannot just ask direct question. You have to probe deeper. If you just ask any problem and the patient, no problem. Actually, there is a problem, just not willing to speak. So with this, you can actually go deeper. So some of these things, you may miss out the subtle signs during your consultation because of the busy clinic. But the AI can actually review back the voice, and then it can analyze to see whether there's any need to recall a patient if there's any issue. So to answer your question, I think there's a lot of opportunity, but unfortunately, a lot of these things are actually in the early phases. We are going to launch a 3-year study to see whether we can detect depression using voice. If you look at some of the startup, there's some startup that's using voice to actually predict dementia, diabetes. But I think a lot of times these are still very experimental with a small group of patients, may not be extrapolatable to the larger population. So to answer your question, I think there's a lot of work need to be done for this. But right now, we can use this as a way to kind of like judge the consult. So you can actually use this to see whether the consultation with the doctor and the patient end up as a good consult, or you can actually highlight there are certain inadequacy so that we can have customer service or patient service people to go in to probe deeper to see how come the consult ended abruptly, how come the patient seems very unhappy at the end of consult. Sometimes, for example, a good thing is whenever I ask the patient, why are you here today? The patient get very angry, upset. What do you mean, why am I here today? You asked me to come here, you see. Yeah, so sometimes patients can be very angry because they're not even sure why they are here. So all these things you can actually go back to analyze because right now there's so much patient workload, but the AI can actually flag out what are the key things that we can actually look into so that we can actually invite the patient to give a more input on how the consult was felt. Because right now it's random. So randomly, our customer service officer will actually send a SMS to ask, how was the consult? Yes or no? And most of the time, it's going to be biased. Yeah, so we may not get the result we want. So that's why this is a way for them to target, to make sure that we can actually highlight what are the areas of inadequacy, send our doctors for further training to improve the consult period, especially for younger doctors. Right now, younger doctors, they are very busy. Some of them may be quite rude. I was one of them. You used to be quite rude. So I think this is something that we need to really improve our bedside manners. Yeah.
Okay, thank you, Dr. Gary. I really appreciate your answers. And just another quick question. We had another webinar with Dr. Philip Gerwil, and he told us that the patient are more comfortable to talk about delicate themes, for example, sexual education or mental illness. They prefer to talk to a machine than to talk to a doctor. And I think, in my opinion, that this voice, the sentiment voice recognition would be with very much value in this specific case. What do you think about this?
You're quite right. I think there was a study done to show that actually the response by the chatbot is actually more empathetic than doctors. Doctors, sometimes we can judge a lot, and sometimes people don't want to be judged. For example, you ask a patient, have you had casual sex? Patient most of the time will say no, but sometimes they'll be more happy to share with the chatbot if it's confidential and things like that. So I have a friend who does He-Health. I'm not sure if you heard of He-Health. So it's Dr. Udara. So he's actually had this chatbot to actually help to identify male condition. For example, the recent monkeypox. So all these things can help to identify male sexually transmitted diseases. So they may be more willing to share with a chatbot, especially if they are seen to be non-judging. Because you can actually see, especially if you see a female doctor, he can actually judge you for being for having casual contact. So these are some of the things that we need to really make sure that when you speak to a patient, we do not judge them. Even sometimes we don't say it, even our eyes can give the thing away. Like for example, let's say the patient say, I have a 20 sex partner, and you can see some consulting doctor's eyes were, wow, really? 20? Yeah, so it's like, okay, that's very common. But anyway, the point is that I think sometimes you're right. The chatbot may be actually more non-judgmental. My sister just mentioned for job interviews and or job advice, the chatbot gives very good empathetic answers to say, I know it's difficult for you to find a job, but let's see what we can do to improve. When you talk to a career coach, sometimes they have their own biases and they may also input their own prejudice inside. So you're already 40, why are you looking for a new job? Just stay with your job. So these are some things that we can actually learn from the chatbot. How can we be more empathetic instead of giving a retort or even a sarcastic answer? Yeah.
Okay, thank you so much, Dr. Gary.
Thank you. Thank you, Dr. Leonardo Aguiar and Dr. Gary. Wonderful discussion. Let's please move on to our second Doctor Innovator, Dr. Olagunju, and I'll let you read her impressive credentials as Dr. Olagunju asks her question.
Thank you, Dr. Gary. Can I be heard?
Yes.
Thanks
Sure.
for the wonderful presentation. I'm particularly fascinated about the patient education chatbot, which is going to take the daunting task of repetitive task of the doctor. As we know, the current doctor-patient ratio in Nigeria is 1 to 10,000, as opposed to the recommended WHO 1:600. So I look forward to the use of conversational AI to ease the task on healthcare workers generally. My key question is, how can we integrate conversational AI into existing healthcare systems in Africa, for example, say in Nigeria?
Thank you for asking the question. Unfortunately, I'm not an expert in Nigeria, but I went to do a quick research. So there's actually this language-specific large language model that the Nigeria government has tried to build. I think it was released earlier this year. So this will actually have 4 languages, I think 4 local language and English language. So these are
after status, now so in China, professor and all that. But the one
Oh, sorry. Yeah. So this is one way we can actually use large language model that is trained on local Nigerian languages to actually be more culturally and language specific to Nigeria. That's number one. Secondly, is also the readiness of the electronic health records. So right now, I've been doing some quick review. Some of the research papers has mentioned that Nigeria hasn't really adopted much of the electronic health record. Correct me if I'm wrong. But there are some areas of challenges. But it's a good thing, it's an opportunity. You can actually learn from countries that has done it. So in Singapore, in Southeast Asia, Singapore is one of the few to actually do the electronic health records, and we made a lot of I think I would say that misjudgment. So a lot of companies, a lot of countries are actually Oh yeah, sorry. So a lot of countries have actually followed Singapore example and decided that we need to actually make sure that the records are shared, interoperable. This is important. Otherwise, you end up having records that are in silo and not able to share. So coming back to the question, how can we build this large language model in this electronic health records? You need some centralized planning. So if you want to, so the government unfortunately has to take the role, or you need to have a large enough provider to be the leader in this. So it's like simply, you can just imagine in 10 years, 20 years ago, all your laptop, all your power charger are all different. I'm not sure you remember those. Acer, Lenovo, all the different brand has different charger. So you need to create some same adapter so that they can actually charge the laptop. So it's not interchangeable, just for charging your laptop. Right now, it's mostly all USB-C. So something has been done to set a certain standard and everyone follows. So to answer your question, I think for this to work, you need to have some ways to actually build in the interoperability between the different health record system in Nigeria or in South Africa. Yeah. Sorry for my ignorance on the South Africa medical system. Yeah.
Thank you so much for your response, Dr. Gary. The electronic record system is actually coming up in Nigeria. A lot of private facilities are well versed in that, and then there are transitions in government hospitals too. It's a gradual process. I believe with time we'll get there, which takes me to my second question. What are the potential setbacks of conversational AI? Maybe generally, if you are not so conversant with the Nigerian setting, and then we see how we can anticipate this and then profile solutions. Thank you.
Yeah, so conversational AI is relatively new in the sense that we only recently added large language model. We remember the old chatbot that was quite dumb. So I guess one of the challenges is firstly data security, make sure there's no leakage of data. So if you look back in Singapore history, we did have one quite a huge case of a data leakage. So this is something that we be careful. So next thing is also responsible use of AI. Actually, we'll keep writing a paper on that. So make sure that when you put what you put inside is something that is secure. And you do not put patient identifier into the chatbot. And you may not even want to put personal information that is sensitive inside the chatbot. So it depends on the use case. If it's for medical consultation, for example, then you need to be secure so information is stored in the system and not through the cloud. Because one of the challenges is that some of the large language model, especially ChatGPT, they have a server in US, so all the data actually goes out of the country. So in Singapore context, we can't really do that. So we have to use a large language model that is actually built in-house in Singapore or hosted in Singapore. Alternatively, you have to build your own on-premise large language model that will actually be probably safer so that there's no data leaving the country. So to answer your question, I think one of the setback is that we need to ensure that the data stays in South Africa or Nigeria so that it doesn't get leaked out. That's number one. And number two, must make sure that people use it responsibly. So they must first be trained to use it. And you also need to know the limitations. For example, a chatbot is just a chatbot. It doesn't replace a medical advice. And sometimes when there's some trigger words, for example, I'm suicidal. So these are some things that you need to trigger a trained professional to intervene. So these are some of the challenges we need to make sure that there are some safeguards, safe rails before you just go deep in. The good thing is we don't have to do this alone. There are standards. I'm not sure you know her or Chai. Chai is a coalition of health AI. So there are some standards that are trying to come in on the responsible use of AI. And so we can actually look for other countries that actually have done it first before we can actually do it ourselves. Right now, I think most healthcare providers are taking a wait and see attitude. Yeah, I hope that answered the question.
Very well, Dr. Gary. Thank you so much. As an anesthetist, I look forward to the day that I can conduct a pre-anesthetic review, at least part of it, using the conversational AI, and then face recognition AI to measure vital signs. That will take a lot of stress off me. Thank you so much.
Thank you, Dr. Olagunju. Wonderful dialogue. Very insightful. Thank you very much, Dr. Gary, for your answers. We have one final Dr. Innovator, then we'll open it up to participant questions. Feel free to type your questions in the chat, or later you can raise your hand. Dr. Alaran, please.
Thank you very much, Dr. David. Dr. Gary, thank you for your lecture. So enlightening. My question is, as regard follow-up of patients who are living in rural areas with low socioeconomic status, and such people are visiting urban areas to access healthcare, probably having erratic power supply, because in our area here, even in urban areas, light is erratic because of rural areas. So they come from rural areas to urban areas to access care. with erratic power supply and internet provision, how will conversational AI be effective in the follow-up of such patients, especially post-op patients? That's my question.
Thank you for excellent question. So I guess number one, we are actually exploring this thing called a small language model. So a small language model is different from large language model where it's trained to do on small specific tasks. So this way you can actually use an inexpensive way to capture data and to respond to it, as well as you can actually make it small enough that it can be battery operated. So the way that you can do it is number one, I'm not sure about the mobile phone penetrance, but in a lot of low resource country, we can use SMS as a way to write your symptoms, and then we can actually have a low resource way to manage this. That's number one. You can also use things to be low bandwidth. So you may not need to have the likes of videos, for example. If you off the video, then the data needs is actually lesser. And also, they can also program the chatbot to check in with patients to monitor symptoms. So it could be a simple temperature, what's your temperature, what's your pulse rate to do this. There may be less real-time interaction because you may need to have good internet for that, but you can still send SMS messages, and this will help to actually track the patient's improvement over time. So to answer your question, I think we can explore low-cost way to solve it, and there is some ways where some of the startups we want to go into, or those social enterprises, because I think with fair, large language model are built for developed countries. We need to actually localize it to countries with resource scarce. And I'm also interested in this thing called reverse innovation or frugal innovation. What this means is that we use technology that is for resource scarce countries, and then over time, if good enough, even large countries, developed countries actually use it. One example was the portable ultrasound machine. In the past, if you are in a low resource country, you use an ultrasound machine that is portable, but it's not as good. But over time, its quality improve over time, such that even for developed countries, they are starting to use portable ultrasound machine. So this is a very good example of reverse innovation. So who knows, maybe the small language model that you develop in South Africa, one day you can also use it in Australia, where it's not really about the cost, it's more about the distance that need to actually make sure that the care is done over vast distances. Yeah. I hope that answered your question.
Yes, it is. Thank you very much. In Nigeria, for and dialects in Nigeria, 100. So will we able to recognize all those dialects, or will it be made in?
I'm sorry, I didn't quite catch that. Can you repeat that?
I said in Africa and Nigeria, for an example, we have a lot of languages and dialects that with conventional AI be provided in all these languages and dialects.
Okay, this is a very good question. I think I mentioned Sea Lion, which is for Southeast Asian languages. So if you have somebody, maybe Bill Gates Foundation, who's keen to do large language model that is trained on African languages, that will be a great area to innovate. So because a lot of times the language model now are trained mainly in English language because it's easy accessible. So maybe there's an opportunity for some people to use either venture capital money or some philanthropy money to build a large language model that's trained on African language. I'm not sure whether anyone is doing that, but if that's the case, that will be a great opportunity to break into this market. Yeah.
Thank you very much for the last question. In case there is a lack of political will, because in Africa, or Nigeria, for example, sometimes we have some obstacles in our healthcare compared to the developed countries. In case there is a lack of political will in making use of conventional AI in our healthcare system, what can be done in such situation?
This is a politic question. I don't think a doctor can answer. But I think the first thing is the vision. So if the vision is clear that the aim in life is to improve the healthcare system for South Africa or for any specific countries, and the politicians, they themselves will have to enjoy the care because it's not always possible to fly to other countries to get the care. And also sometimes the people may also require the healthcare standard to improve over time. Because I think as a country goes richer, when you cover the basic needs, the next step is health. So what the developing countries is facing is the same thing as developed country has done. That has first is economic development, then maybe education, and then slowly we actually focus on health. So you can see that as time goes by, you look at the developed countries, like OECD country, for example, the average spend on healthcare is 10% GDP. So you look at US, it's 17% or even higher. Okay, so there's a lot of money on spending on healthcare. So over time, there should be some trend towards the need for better healthcare. And if healthcare can't be financed by the government, we can always tap on philanthropy money to actually do that. I'm not expert in developing countries, but I see that there's a lot of opportunities to tap in funding because I think a lot of donors also want to do meaningful things. So how can we consolidate all the money that is for aid and earmark some of the money to improve healthcare in South Africa? I hope that answers your question. Yeah.
Thank you very much.
Thank you, Dr. Alaran. Thank you, Dr. Gary. It's a wonderful dialogue. Those are really some excellent examples and innovations and case studies and even some ideas that some of the Doctor Innovators may want to pursue together with our technology partner providers. So we're going to move now to our interactive Q&A session. I've typed in the chat asking for any questions you might have. Feel free to raise your hand down at the bottom. If you click on the hand tools or click on the bottom to raise your hand, or just raise your hand and I can recognize you however you would like. Any questions? Opening up to all participants now. Okay, I think we have some coming in here to the chat. Yes. How can patient feedback be integrated into conversational AI systems for continuous quality improvement?
Okay, where I take that. So we have this thing called NHG Care app. So my company has created an app that can capture prompts and prem. Prompts are patient-reported outcome measures. Prem is patient-reported experience measure. So right now, a lot of times we have feedback from patients that is sent in via email or all these things. It takes a long time for a human to sift through everything, and then they actually divide into service and clinical. Those that are service, we'll try to apologize for our lapse in services, and then we'll try to improve it. Those that are clinical in nature, we'll escalate it to more clinical trained personnel to look through whether there's any validity in that, and then we'll explain to it. So to answer your question, I think chatbot or all these conversational AI or large language model can help to do this sieving so that we can reduce the time needed by a human to sieve through this. So how this can be done is like spam. So I'm not sure whether you learn about spam. So what they do is for email spam, they'll actually classify certain messages to be spam, certain messages not to be spam. Similarly, we can actually classify complaint feedback into service quality, clinical quality, or both. And then from this, we can actually use this to actually help to then draft even feedback letters to actually address the issues. For example, doctors never smile at me. So we can say that, I'm sorry this happens to you. We will educate our doctors to pay more attention to their bedside manners. As such, we will actually send these doctors to actually for ethical classes, things like that, so that to actually address the issues that some patient may have. But this is more of a service issue rather than a clinical issue. Yeah, I hope that answers the question. Anybody else want to chime in?
Thank you, Dr. Dr. Leonardo has his hand up, please.
Thank you, David. Dr. Gary, what methods can be implemented to ensure the AI accurately captures and integrates the emotional nuance in patients' speech?
Okay, this is quite a technical question. I think it's really about okay, so there are two types of for what I know, there are three types of learning: supervised learning, unsupervised learning, and semi-supervised, this like that. So basically what you do is this, we need to actually has somebody to review back the video to help to classify whether this is relevant, whether the patient is sad, whether the patient is anxious, things like that. So with this, you can actually label the records. And from there, you can use supervised learning to actually help classify it. That's one. What is more interesting is you can now use unsupervised learning without a human to actually look into it. And now there's even semi-supervised learning where you can actually label some of the voice file, and then the computer, the machine will learn which are likely to be supervised, and they can actually auto label. Of course, you need to have some human in the loop to actually look through to see whether it's relevant or not. But I think this is really a technical question, so I think we can get the real data scientists to answer this question. So unfortunately, I'm not a data scientist, so I can't really help you on methods. Yeah.
Thank you. Any other questions? Okay, I see hand from Dr. Charles Epignan. Please, Dr. Charles.
Yes, thank you so much. That was a wonderful presentation. Just want to comment on the use of conversational AIs as it plays a role for the healthcare personnel themselves. I hope I can be heard.
Yes, you can.
Yes, you can.
All right. So for a large extent, much of the conversation tends to focus on conversational AIs as it pertains to the patient. To a large extent, one can also find its application in terms of its utility for healthcare personnel also. I think an example would be in assessing the stress level of healthcare personnel day by day as they go through their daily activities, residents as well, all across the nation, where one sits to have a conversation and then his stress level is assessed. His ability to cope with daily stresses is also assessed, and recommendations can be made based on that. I think to some extent we undermine the psychological impact of patient losses and all that. So I think that's also one typical area where that can find application. The other comment I want to make was, I think has been partly answered in terms of quality assurance checks when patients interact with conversational AIs regarding their concerns. Comments have been made regarding the feedback mechanisms. So I think in part that has been touched. The last area I probably would want to comment on has to do with modalities in which the patients interact with conversational AIs. I don't know to what extent that is available at the moment. Is it something that probably like an app where patients would have to converse at home or walk into the hospital, and then there is a dedicated say office where the interaction takes place? Because like the presenter has talked about, some of this may be supervised. So I don't know if some comments can be made regarding that. Thank you very much.
Yes, Dr. Gary, would you like to?
Okay, I didn't quite catch all the question, but the first question I think you're referring to, number one, is about healthcare professional. So recently, I think burnout is a big issue. I think you mentioned, I think Dr. Ganiya mentioned that in Nigeria, there's a huge lack of healthcare professionals. So some of them are burnt out, and some of these things can really detect when you can see that somebody starts to reduce the, number one, the quantity of consult. They just not ask the questions and just go through the motion. They can detect certain areas of burnout when they become very depersonalized. So I think there is opportunity to do that. That's a very valid point. So we can actually detect physician or nurses burnout by using this conversation AI on the professionals. The second question, I didn't quite get it, but the third question I think is about Yeah. So I didn't really catch the question, sorry. So second question is about the patient consent. Is that a question? So for patient consent, I think for our recording, we actually ask the patient consent before you do it. For most of the time, our feedback is that patients are quite keen because it's part of the consult and it's actually to help improve the thing. And the first thing is reassure that all the capture are going to be captured in the system and they'll be deleted after a month. So after they've been transcribed. So there are some assurance that the data not leak out and everything stays there. So interestingly, some patient even tries to tape the conversation between a doctor and the patient because number one, they maybe have a extended family, so they may not all be there for the consultation. And by taping it, you can allow the other family members to make a decision, especially if it's a elderly patients, what sort of treatment to go for. But most of the time, we don't allow patients to record down. So I guess to answer your question, I think recording is actually quite accepted and appreciated by patients because they may not understand everything in the consult. So having some ways to actually record a consult will actually help them to better make decision. So I didn't quite catch the third question or the second question. Yeah.
Okay, thank you, Dr. Gary. Does that answer your question, Dr. Ekpinian? And I wanted to
Yes, it definitely does. I think the third clarification I wanted to make was with regards to the modalities at which or through which patients interact with conversational AI. Is it home-based, hospital-based?
Well, in Singapore context, right, we're still not in active use. Right now, we are still launching next week. So all these are very new. But I know that there are some hospital group in US that have tried using it. The feedback is that it's really very efficient for the doctors because they no longer have to take a history and type the thing. Because most of the time, there's a lot of administrative work after a consult to reorganize the notes into something that is more storable in the records. So in that setting, it will be mostly outpatient setting. I don't really think you can do that in the inpatient setting because it can be a bit more noisy and you should have more time to actually speak to patients. So it's more of an outpatient setting where there are lots of patients to clear and you want to really reduce the administrative work to key in the information. Yeah.
Okay, thank you,
Right.
Dr. Gary.
Thank you very much.
Thank you, Dr. Ekpinian. And I want to bring your attention to the chat. Dr. Gary has shared the massively multilingual language models for Africa, and maybe we can share the CHAI, CHAI that you had mentioned, and maybe later we'll share any other links that you didn't get. Dr. Sampio, I see you here. Do you have any questions?
Hi, David.
Yes.
Oh,
Hello.
did you ask for me?
Yeah,
Sorry.
so I wanted to see if you had any questions.
Oh, no. For right now, no questions. But this is my first session. It's a pleasure to participate, and I really like the so many people from different parts of the world, so many different questions, and it's really interesting. And this was my first session in here. I was just
Okay.
getting a acquaintance.
Welcome. Okay, welcome
Thank you.
to Joyce. Thank you for joining us. Anyone else have a question? I can call on someone else if
David, I just have
yes.
one
Okay, Dr.
one
Leonardo.
question, and I would like to know the insights about how we can use this AI analysis to integrate into clinical workflows to empower healthcare providers in addressing patients' mental health or any other disease. What do you think about these workflows in using this AI technology?
Okay, so I think firstly must be very clear. For example, if let's say there's a caregiver coming in and a caregiver is showing signs of anxiety, depression, or even suicide, whether we can actually add on the information, because that is not a patient with which we have a patient-doctor relationship versus a caregiver. So we need to be very clear. So let's get that aside. So focusing on the patient at hand, I guess as a doctor trained, you should also probe deeper into the ACE, the ICE. Pardon me. So I stand for ideas, concerns, and expectations. So these are things that the AI can actually help you to kind of like organize what is the underlying thoughts. For example, if a patient has a, let's say, bleeding, and you recommend a colonoscopy, and the patient say no, do you just say no, so no? Or you probe deeper and say why no? Is it because patient is scared? Because patient got an elderly mother you take care of, so he can't have do this? And do you just let it go and let him be untreated or uninvestigated? So the question back to you is that what's the responsibility for the healthcare providers? I think as if we have the luxury of time, we really like to go deep into the psyche or the mind of the patients to understand their decision-making process. And by doing this, we can help them better make well decision. So this can be sent, for example, if the patient is not ready for a colonoscopy, we can still send a reminder 3 months, 6 months later to remind the patient, hi, how are you doing? Is your symptoms still there? Do you usually like to arrange for a colonoscopy so that we can further investigate? So it's a way for them to have a way to get back to the system. If not, in a few months later, a few years later, they may end up with late-stage colon cancer, which is something that we don't want to happen. So I hope that answers your question, because we really want to help improve the patients, not just take whatever the patient say at face value. We investigate why is he saying that. Yeah.
Thank you.
Oh,
Thank you, Dr.
thank you, Dr.
Gary.
Gary.
Thank you,
David,
Dr.
just
Leonard. Yes.
just one quick one.
Give one less.
Dr. Gary, in my consultation workflows, I give the patient a pre-consult sheet that he can answer if he doesn't smoke, any pains, any medications. I think it would be a very good use to use AI so the patient can do by the comfort of his home, have more time, because sometimes they feel a little pressure to do in the consultation room. It's thank you so much. Thank you so much. Thank you for the insight.
Thank you. Wonderful discussion. I think we have one final question here in the chat. What opportunities does AI present from streamlining healthcare administrative tasks? And the second question, how can transparency and accountability be ensured in AI-driven healthcare solutions?
So in my role in Health Empowered by AI Launchpad, we have 3 tracks: clinical track, analytical track, operation tracks. So this is actually under operation. So operation we divide into normal ops and clinical ops. So normal ops will be simple things like appointment scheduling, things like feedback gathering. All these things are administrative tasks. And we can even go into clinical administrative tasks. What is that? That's actually things like quality assurance, auditing, for example. So we may even send all your case notes into the AI to see, is there anywhere we can give good feedback so that you cannot miss anything? Could your history taking be more succinct? Do you miss something that you could have done to intervene? And this is sent confidentially to the doctors, to the nurses, to help improve their clinical practice. So these are some of the things we can talk about clinical ops or education. So these are some of the tasks that we can actually do that. The key thing is that AI is not there to replace humans, it's there to augment, which means that humans should get it easier to do your administrative tasks. So tasks that you're not very keen on, for example, calling patient up, reminder of the appointment, why not use the AI to remind? The AI can be used different persona, different data to convince them to come for the appointment. For example, we noted that you missed the appointment. Is there anything that you will share with us? Is there any concern? And then send that again in a few days later. Hi, we noticed that you still did not respond to our message. Is there a way for us to help improve your condition? Has your condition improved? And therefore, so this is some ways we can send reminder system to the patient. That is for the administrative part. Transparency, accountability. Okay, firstly, transparency, there are 2 parts of transparency. Firstly, if you use any AI, you need to disclose that you're using it. Any model, you need to disclose that the data, where is the data trained. So this is for the responsible use of AI. So transparency is important. For accountability, again, unfortunately, accountability always lies with the physician. The hospital is accountable by means of, I'm not sure what is that called. I think it's fiduciary liability. I may not get it right, but that is apart from the physician liability. So that's why it's not about human in the loop. At the end of the day, the AI is a tool. It's not to replace your decision making. It's there to help you make better decision. For example, if let's say you say this patient is fit for discharge, go through the AI. Did the AI pick up something that says otherwise? Another thing is if a patient you think the patient should be admitted, for example, go through the AI to see better, is there a way to manage the patient at home instead? So all these things is for you to suggest improvement so that you can actually either take the advice of the AI or ignore the advice of AI. It's not meant to replace you. It's meant to send you alert to make sure you don't miss anything. So one of the key use cases is radiograph, for example. So a lot of time radiograph, if you use the AI, you can probably detect early stage cancer. The question is, why did the radiologist not detect that? Because maybe it's because, number one, it's too small. Number two, many of these cases over time may be nothing. Just that that one or few cases that turn out to be cancer. But can you use the AI to help give a check just in case to make sure that you don't miss anything? So the radiologist can use the AI to check, is my X-ray really normal? Or is there something that I could have looked deeper into? Yeah, I hope that answered your question.
Wonderful. Thank you, Dr. Gary. And thank you to all of our Doctor Innovators. Thank you to all of our participants. Hope to see you again November 16th, same time, 8 to 9 a.m. U.S. Eastern Time for Shamir Cotter with Sanofi. So thank you very much. Have a wonderful rest of your morning, afternoon, and evening. Take care. Thank you, everyone.
Thank you so much.
Bye-bye.
Bye-bye.